The fact is that wounds are a universal challenge for Canadians of all ages, and especially for those who suffer from complex chronic conditions such as diabetes. Wound care is associated with increased healthcare resource utilization, and most importantly, they affect the quality of life for those who suffer from wounds.
Nurses in all practice settings are challenged by the need to provide quality wound care. This challenge is complicated by the fact that there are so many different types of wounds, etiologies, risk factors, and treatment options. Additionally, each patient has unique and particular needs that nurses need to consider. How can we expect nurses to provide quality wound care if they don't have ongoing access to evidence-informed resources to support clinical knowledge and decision-making? How would you feel if you walked into a patient's room to do an admission assessment and uncovered a foot that looks like this?
Our work builds on several years of experience in developing and disseminating high-quality simulation teaching and learning resources that make learning fun, accessible, and cost-effective. Our virtual simulations are based on self-regulated learning theory and current evidence to inform clinical decision-making. We will develop an online module that incorporates best practices for the assessment and management of all types of wounds. What makes our module innovative is the use of virtual simulation games and a new virtual simulation objective structured clinical exam, or VOSCE. Learner performance on VOSCE will drive learner-centered remediation through links to relevant evidence-based resources. Our innovation harnesses the power of technology to engage a new age of learner and enhance their learning. Our online platform allows us to deliver a standardized education program that can be assessed anytime and anywhere. Our clinical interactions are filmed from the nurse's point of view, essentially putting the learner into the nurse's shoes. This, along with the gaming components, promote clinical decision-making, and the ability to repeat the game promotes the mastery of content.
Our original approach engages both teaching and learning experts and clinical experts to create an immersive and engaging learning experience.
We can create video-based virtual simulation games using the CanSim template. Learners select the best of 3 potential nursing actions in response to a given clinical situation, and then receive immediate feedback following the selection of an incorrect or correct response. We will create a virtual OSCE to provide a cost-effective and accessible approach to summative assessment of participants who have accessed the Educational Toolkit resources and completed the Wound Care series of virtual simulation games. To our knowledge, this approach has not been previously undertaken. Most online educational modules rely on straightforward multiple-choice quizzes.
Our innovation will improve knowledge and skill in assessment and management of multiple wound types by nurses, nursing students, and other healthcare professionals like physiotherapists, occupational therapists, and physicians. This innovation will make education more accessible and cost-effective. We believe this innovation will help to standardize the way we deliver wound care. As a result, the intervention will contribute to high-quality, patient-centered wound care that will enhance quality of life of patients across Ontario and beyond.
Our dream team has the expertise, experience, and track record to deliver the goods. We have a unique partnership of passionate and creative individuals. Our dream team is led by Dr. Marion Luctkar Flude and Dr. Jane Tyerman. Both are certified Canadian simulation nurse educators and co-presidents of the Canadian Alliance of Nurse Educators Using Simulation. We are so privileged to have Dr. Kevin Wu as our clinical content expert. And we have 2 leaders in online education, Dr. Deborah Tergano and Dr. Barbara Wilson-Keats.
Through previous work with Coupon, Causin, and CanSim, we have established relationships with nurse educators across Ontario and Canada. Our awareness campaign will harness social media and target nursing organizations and wound care networks to reach as many nurses as possible.